We are in the midst of an arthritis epidemic, and it's only to get worse as baby boomers age.
Yeah, not to mention other orthopedic problems like bad backs and hips and torn rotator cuffs. But CBS 2's Dr. Max Gomez is here to tell us there's a way to heal those aches and pains, and it involves your stem cells.
That's right, and I know as soon as you hear stem cells, you think controversy, but actually what we're talking about here are not the embryonic stem cells that couldn't be used for research during the Bush administration. These are your very own adult stem cells that have become the cutting-edge way to treat osteoarthritis of the knee, hip, and ankle, and even back pain. It's today's Go New York report. Robert Wilson is a lot like millions of baby boomers. Years of sports have left him with a couple of pretty bum knees.
I couldn't bend my knees, I couldn't kneel on my knees, I couldn't bike, I couldn't even walk for very long.
The 52-year-old was looking at knee replacements in his near future until he came to the Rocky Mountain foothills near Denver, where a pioneering clinic is using adult stem cells to treat orthopedic problems.
I actually do cartilage or repair a ligament by becoming a piece of that ligament or a tendon or bone if there's a defect in bone.
The first step is what Wilson had done a few weeks ago, extracting adult stem cells from bone marrow in his hip. After the stem cells are extracted from the patient's own bone marrow, they're brought here to this lab where they're grown in special tissue culture to multiply their numbers, making sure there are millions to inject back in. Wilson is having a series of injections that deposit his stem cells in the arthritic areas. Knee MRIs of other patients show where new cartilage is growing in. X-rays of a broken arm that wouldn't heal show new bone after stem cell injections. Even more exciting, Kim Gillman was practically bedridden a year after spinal disc surgery.
This pain was beyond anything I could possibly comprehend. It was truly crippling and more frightening than anything I've ever experienced in my life.
Today, after stem cell injections, she's actually back to jogging. The promise is so great that more than 1,000 clinical trials are testing stem cell therapy. That's why a company called NeoStem has begun banking people's own adult stem cells now, before you need them.
You don't want to wait till it's too late. You don't want to wait till your stem cells or your body is damaged, has a cancer. You want to do that today before you get exposures that could damage your DNA and your stem cells.
Now, another advantage to storing or using your own stem cells is that they are your own cells, so there's no risk of rejection or contracting infectious disease. And there are clinical trials showing promising results using adult stem cells for heart failure, diabetes, lupus, MS, and even macular degeneration. It's sort of the silver lining behind the ban on embryonic stem cell research was that all of this research then was forced into the adult stem cell area, and they're actually finding that it's actually very useful.
Well, those are clinical trials, but there are orthopedic uses that are actually helping people right now. What do they cost?
Well, they're not inexpensive. For example, a treatment here for the knee treatment for knee cartilage, like Rob was having, is about $7,000, and it's not covered by insurance because that's not one of the sort of approved uses at this point. It's kind of off-label, if you will. But on the other hand, if you can avoid a knee replacement or, rotator cuff repair, broken bones, arthritis of the ankle, the hip, other things that they're using it on, spine problems, it may not be such a bad deal, but it is,
what is relief worth?